Today, I want to talk about some successes. I want to talk about some patients of ours who have been reversing osteoporosis. Now, I'm going to present 3 patients today, and I'm going to present them because I want to give you hope that osteoporosis is reversible and that it is possible to improve your bone health, and we have the data to show it. So let me walk you through these patients. The first one is one of my favorite patients. She's a 52-year-old woman, and she came to us because she was blown away by the diagnosis of osteoporosis. I mean, blown away because she was young, active, fit, felt great, looks great. To think that she was at risk for a fracture, a spine fracture, a hip fracture, losing her independence just like rocked her world. So she said, I got to reverse this. I got to fix this problem. Dr. Doug, you're my guy. Let's go. Cool. So we did all the things. So she had some habits that needed to be worked on. She had some sleep that needed to be fixed. She was not on hormone replacement therapy, and she had just recently completed menopause. So she was over 12 months out from menses. So she was now postmenopausal, not on HRT. Her diet could use some work. Her exercise program could use some work. So we did all the things like we always do. And at the end of 12 months, we saw some improvement in her bone density where her hip went from negative 2.0 to negative 1.6. That's a 7.3% improvement, but you might be saying, that's not even osteoporosis. True. Her spine was negative 3.0, but her spine didn't get better. Her spine went negative 3 to negative 3.2. What's going on here? So she was excited that her hips got better, but not happy that her spine got worse. So we sat down, we went through all the things, and we said, well, what's going on? Now, there were some areas where we could improve HRT levels, maybe some dietary things, but for the most part, she was doing pretty well. So we made some tweaks to her program, but when we started talking to her about what kind of training she was doing, she disclosed to us that she wasn't able to do the upper body stuff and load her spine because she had low back pain. She had also been in a car accident and had some worsening low back pain as a result of that. So we said, okay, well, let's tweak some things. She met with Dr. Truby. We figured out how can we load her spine? Let's do some farmer's carry. Let's do some other stuff. And so she started loading her spine. All right, now fast forward another 12 months. That negative 3.2 went to negative 2.1. Awesome. 18.7% increase from the previous year. Now her hips actually kind of stayed the same. And when I called her to talk about this, I was like, so what's going on with your hips? She was like, oh my gosh, I've just been focusing on my back and I haven't been loading my hips. Okay, that's fine. So now she's going to do both, but she's in a much better place and she understands the trajectory. She understands what she needs to do to help improve her bone, and she feels great. All right, so let's talk about this next patient. Now, this next patient is a gentleman, actually, which is not that common in our practice, but this is a guy that I want to present because he's got a lot of data. We have data going back 20 years. So he was diagnosed in 2002 at the age of 46, and this was a diagnosis based off of a work screening x-ray. So he had a chest x-ray done, and they were worried about the look of his ribs because apparently they couldn't see his ribs. So his bone health was so bad that they couldn't see his ribs on x-ray. And so they put him on Fosamax, 70 milligrams, and his T-score initially improved from negative 3.8 to negative 3.4. Great. But then the next year it went back down. So then the doctor switched to Forteo, and his T-score went from negative 3.4 to negative 3.3. Great. But then it started to go back down, actually while he was on Forteo, which tells you how resistant this guy is to building up bone. So he came to us in 2023. Now, there's quite a bit of a gap here between when he stopped Forteo. He kind of stopped getting T-scores, and so he didn't get another scan until 2023, and his T-score in his spine was negative 4.8. Now, that's an oh shit moment where you realize, not only was I not successful on the drugs, but now I've slid a lot in my bone density, and now I don't know what to do. So you could potentially say, well, he's just got low bone density, and he hasn't had a fracture yet, so he's really not that bad off. I mean, anyone with a T-score negative 4 is probably worth looking at, but this guy also in the interim has had 4 vertebral fractures. So yeah, he is in a really bad starting point. So what do we do? He's already been on an anti-resorptive. He's already been on an anabolic. What do we do? Do we put him on Avinity? Do we put him on Reclass? Do we use one of those big guns, which actually aren't any better? From my perspective, this would be the wrong approach because he's already failed both an anti-resorptive and an anabolic drug. He needs a comprehensive approach. So we do the things that we do. We talk about diet, adequate protein. Let's do the resistance training with caution, with a lot of thought as to how we're going to do it because he's had 4 vertebral fractures. And then we optimize his hormones. He did have low testosterone. He was interested in using peptides. So over the course of 12 months, he was as aggressive as he could be, and his T-score went from negative 4.8 to negative 3.9. That's a 17% increase in BMD in the course of 12 months. That is awesome. Now, he still has osteoporosis. Is he out of the woods? Absolutely not. His hips did get better, and they're not as bad as his spine, but he's not had a fracture. He is getting better. He still has osteoporosis, but he is so excited because he knows that he can continue to improve. So he is, again, really excited about the trajectory. He knows what to do, and he knows that he can do this indefinitely. All right, now the next patient is also another guy, and I'm sorry that I chose two men. We have lots of women cases that I'm going to present as well. But this is a gentleman who was 63 on his diagnosis. So he had gone on a weight loss journey with my wife's company, PhD Weight Loss and Nutrition, and he got a DEXA because really he was more interested in the body composition. And lo and behold, he has osteoporosis with a T-score of -2.6 in his spine, -2.7 in his hips. That's not terrible. But again, this is another guy that was shocked because he's an active guy. You know, he's out there, he's doing all kinds of sports. He's like, how could I possibly have osteoporosis? But he wasn't going to settle for that. So he knew that he had to push through that. He had to find a solution. So he joined the program. And what I like about his case, and the reason why I present it, is that he was compliant in a lot of ways, but non-compliant in that he wanted to get but he does a REM every 6 months. And so now we have his data. So his spine goes from -2.6 to -2.4 to -2.3 to -2.0. That's a 26% improvement. Hips, -2.7, -2.4, -2.2, -2.0, 24% improvement. That's awesome. You know, and what's really amazing about his program is that we didn't do anything super fancy. You know, when he came in, his testosterone was okay. It wasn't great, but it was okay. It didn't need to be replaced. You know, he was interested in the gut work, the dietary work, the resistance training, the impact. He did all the basic stuff and was able to see these improvements. And so, you know, he's not only feeling good about his bone health, but he's actually really feeling good about his cardiovascular risk. He's feeling really good about his dementia risk. He's got some interesting genetics around that we did for him. And so he now feels like his health span has taken an entire shift. Went down this weight loss journey, reversed some fatty liver issues that he had, and now he's fixed his bones and understands his cardiovascular risk and dementia risk. So he's so excited to have worked on osteoporosis through the lens of Healthspan. So those are just 3 cases. I have a lot more that I want to report to you. Those are 3 of my favorites, and I haven't reported them on this channel yet, so I wanted to get those out there. Now, does every one of our patients improve their bone density like 15 to 24%? No. Remember that not losing bone is actually a win. And we see patients that'll have subtle improvements, 2%, 4%. I'm going to present those too. I present these because, again, I want to give hope, and I want you to know that bone loss can be slowed, stopped, and reversed. So if you're still struggling to put together your program, hopefully this gave you hope. If you're looking for more information, consider our Masterclass. Masterclass is where we go over how we create programs like this. We talk about the literature a little bit, and we have time for Q&A. So if that's your next step, link for that is in the description below. It's totally free. Please join us for the Masterclass. Remember too that a diagnosis of osteoporosis is not the end, but deciding to reverse it is a beginning. Thanks for watching this video.